In a world where beauty trends change faster than we can catch our breath, one truth remains. How you feel on the inside will always show on the outside. Tonight's conversation reminds us that beyond Botox, fillers, and aesthetics lies a deeper story. A story about self-worth, the pressures we carry as women, and the quiet battles between who we are and who the world expects us to be. Aging is not a punishment. Wanting to enhance yourself is not a crime. What matters is your why. It's Purple Nights. I'm your host. My name is Ross. Every Thursday, we host a very important conversation on this platform. It's called The Wellness Pod, hosted by my good friend and I, Miss Agatha, Atlholang, certified life and wellness coach. All right, tonight's episode is very special. I did say we were speaking to the ladies specifically tonight, not maybe exclusively the ladies, but definitely mostly the ladies. All right, our conversation tonight happens to be about a very hot topic. We're talking facial aesthetics, enhancements as well. You know, the Botox, the injections, this, that, and the third. All right. If you're interested in learning about all of that, then you are definitely on the right frequency, definitely in the right place tonight. All right. We are in studio for you on a WhatsApp +267 3956 962, as well as via SMS on 14962. So without further ado, let me introduce my guest, starting with my co-host. Good evening, Ma. Hello.
Norwar, good morning.
Yeah. I've had a long week, my friend. It's a miracle I'm here.
You look so pretty.
It's just by the grace of God.
I was going to say that. Hey, she's glowing. Look at her. She just makes it look so
because you can't look like your problem.
No.
You know?
We should be asking you for glow tips, not the other way around.
Let me tell you a secret about me. If the skin looks a little bit glowy and everything looks a little bit too good, just know that I'm going through it. Just know that week Ross is having a time. That's how you know with me.
You look pretty, girl.
Thank you so much, ladies. Thank you so much for joining me.
It's lovely to be here again. Ross missed you. I hope you're good. I hope you're well. And let's get into it.
Absolutely. Dr Tasneem Mitha back on the Wellness Pod again. Welcome.
Ross, thank you so much. And like I was going to say, Aggie beat me to it. I was going to say you're looking beautiful today.
Thank you so much. Thank you, ladies. You guys also, your skin is glowing. I mentioned that at the beginning of this. And it is just fitting that we would be having a conversation about aesthetics this evening. You can't see us because you're listening over the radio, but just know that the ladies are looking the part tonight, all right?
And they'll actually get to watch the episode on Ikage Motswana on the YouTube page.
Yeah, eventually.
Yes.
Right? So the proof will be in the pudding. We're not just saying things, But yeah, thank you so much for joining me this evening, ladies.
Yeah,
like I did say, the topic tonight is facial aesthetics, enhancements, and that kind of thing, right? So, of course, we had to have Dr. Mitha back here. She runs dental and facial aesthetics. Am I right?
Correct, yeah.
Right. And you are what we call an expert injector.
I'd like to call myself that, but yes, it's a work in progress. So you always have to be reaching for higher heights.
Right. All right. So let's talk. Maybe let's clarify for somebody who's new to all of this, who doesn't understand or has never really gotten into any of this before, and finding out what it is and how it works. What is facial aesthetics?
So facial aesthetics or facial enhancements,
right,
as I like to call them, are essentially non-surgical procedures,
right,
that we use to improve and enhance certain features of the face. And not only the face, we also work on the neck, décolleté, hands, butt, thighs, inner arms, abdomen. So a lot of body parts that can be enhanced non-surgically fall under the bigger umbrella of facial aesthetics, so to speak.
Right.
And that would include things like wrinkle reduction treatments, volume replacement treatments. We accentuate certain features.
Right.
We correct certain features. For example, non-surgical rhinoplasties. If you have a hump in your nose or something like that, those are the kind of things that we can correct or enhance non-surgically.
Right.
And that is basically what facial enhancement is.
So it's basically also kind of an alternative to invasive cosmetic surgery.
As an alternative to surgical procedures, whereas you're actually physically going under the knife.
Right.
Whereas here we're using injectables, products, materials, manipulating products in different ways to enhance certain features of your face, to improve certain features of the face without doing any surgical procedures.
Right. Let's talk a little bit about, I want us to kind of destigmatize it a little bit, because a lot of people, even, possibly somebody listening to us right now, thinks that's all a bit plastic surgery-ish, you know, and I think it is one way of looking at it, but there is definitely a world out there of procedures that are available to somebody that are, that are enhancing in a good way.
Of course.
Right?
Yeah.
So let's talk about why you find fulfillment in that area of work, in that specific profession, kind of the pros of the work that you do.
So I've been practicing in this field for about 8 years now. And I mean, obviously it goes without saying that, I find joy in producing results and to making women look beautiful, making them feel the best versions of themselves. But it's not only about that. We all have body insecurities.
Yeah.
Every one of us.
Yeah.
And I feel that when you can address people's insecurities, it actually empowers women.
Yeah.
Women become more empowered in the workspace. They become more confident within themselves, in their relationships. And for me, that is the joy that I feel in this particular profession, is because I feel I give women back what they were insecure about.
Right.
And, we all want to feel good. So when you feel good and you're looking your best and you're feeling your best, you're going to project that out there, whether it's in your workspace, in your relationships, in your social environment.
Right.
So for me, that's, I think, the most fulfilling part of my career in this particular field.
Yeah.
And then also the fact that, it's knowledge. It's always nice to have knowledge about things. People come and ask me, I have this, or what can I do to age better? Or, I have these scars or whatever. And you're armed with the knowledge to be able to help them and, guide them as to how to move forward with those particular issues.
Right.
So, yeah, it's twofold for me.
Right. We were actually just having a discussion earlier, Agatha and I, to say, when we talk about aesthetic enhancement, it's okay. It's okay to.
Everyone's doing it. Hello.
Yeah.
We're all doing it. Aggie's doing it.
Well, I've done it.
Your neighbor's mom is doing it. Everyone is doing it. And this is the thing, the stigma is not there anymore because everybody's doing it. They're just not saying it. They're just not sharing. But
So
I'll
maybe
tell
the
you,
stigma is
everyone's
there.
doing it.
So maybe the stigma is there because they're not sharing it, because they feel like maybe it is, and that's something that I'll talk to Agatha about, as the life coach in this, the relationship we have with our bodies and shame as well. Do you think that there's an element of shame that plays into the fact that people aren't talking about it?
Yeah, I think for me, the only problem that I think I have is, especially with us as women, is the dishonesty behind it.
Yeah.
In not really being honest about what it is that we're doing and putting up appearances and bringing this fake version of ourselves that says, I am perfect, I'm this, I'm that.
Yeah.
And, I'm 60 and I look like I'm 25 and I'm not doing anything.
I haven't done anything. It's olive oil.
Yeah, you know what I'm saying?
Exactly. Sharing organic beauty secrets when you know that you've been to
Exactly.
Dr. Mitha's office.
Exactly. So for me, I think my biggest problem is that, and that's really the part that I would like to address. We shouldn't put on a front.
Yeah.
As people, you can still be authentic in your aesthetics. You know what I'm saying? Yeah.
All right, we're going to take a short break, and then I'm going to come back and then get into modern day, society and what you see happening, Agatha, as a life coach, and then also get into what Dr. Mitha is seeing out there as well. All right.
Yeah.
7:49 is your time on Gabs FM, Power to Engage Your World. Right after the break, getting back into that and how that contributes or is it's relationship with your overall wellness, right? Featuring in studio tonight, Dr. Tasneem Mitha, who is, we're going to call her an expert injector. All right. She's been at this for quite a while, 8+ years, you said.
8 years,
Dr. Mitha.
Correct.
8 years, and you know what you're doing for all intents and purposes, right?
I'd like to think so.
Yeah. we're declaring that right now. Dr. Mitha knows exactly what she's doing, and so does Agatha, the life coach. Let's talk about, because we are working on destigmatizing some of these procedures because they're okay. It's okay to want to boost your confidence with, a little enhancement here and there. And, we've just been having just off a conversation about, we started off the conversation with a conversation about shame. Using the word shame as, a description of what women are kind of experiencing, to say, do they not want people to know about what they're doing? If they're getting aesthetic enhancements because it's shame. But you did bring up something interesting, Agatha, to say it's gatekeeping as well. Women are not interested in sharing their beauty secrets and wanting others or misleading people into thinking that their beauty is all the way natural. It's okay for it not to be. It's okay to have had a little bit of help.
Exactly.
We're women, we're human at the end of the day. But why do you think it is that, there is that element of gatekeeping?
Taz, do you want to answer that, or should I go for it?
I think you can. Let me think on that one.
Okay.
You can go for it.
I think, let's go back to this whole thing of us. I was hearing feminism, women for women. And we are on this trip, and we're all like, there's enough room and there's enough space for everyone. And sometimes I beg to differ. Yes, the idea is there, but we don't show it through our actions. There's still this competitive aspect around us. I'm not going to share my beauty secrets with you. I'm not going to share this because I don't want Ross to look as glamorous and as awesome as I am. It's like we all want this glory all to ourselves. We do that as women, and this is a conversation that we really need to have amongst each other. In as much as we talk about how much we like, we love each other and we are just there for one another, I beg to differ sometimes in our actions and just how we do things, So I think we really need to look into that. I think we really need to dig deep and just be on a tip, if it can help your sister, dog, share it. It's not just you sharing also to help your sister look better or feel better about herself. It's also your sister who's actually the doctor who's trying to feed her family as well.
I think also it's not so much about shame, being ashamed to do treatments. It's also how women feel that people will perceive them. People will perceive me as being vain. Or people will perceive me as being someone who's materialistic. Or, so it's not just completely about being, I'm ashamed to do this or to share it. It's also, what do you think other people are going to perceive? And unfortunately, that's the reality of the world, is that when you spend money on things like this or on a nice handbag or, expensive shoes, people will perceive you to be...
Judge you a little bit.
Exactly. And look at you a little bit differently. And particularly in facial aesthetics, people will think you're being vain.
Right.
And, possibly not understand the true reasons behind why you're actually doing it.
Right.
So in essence, going back to what Tasneem is saying, is that you have to have a healthy relationship with yourself as well and be confident in yourself and your choices.
Exactly.
If this is what I want to do, this works for me, this is my thing, and I really don't care. Louis Vuitton bag 20. I worked hard for them. They are my thing.
Right.
So if I want to go and get my nose done and I feel like my frown is just out there and I don't want that frown, that's I should have a healthy relationship with that.
And I want to get a little bit deeper into that, Agatha. When you say have a healthy relationship with that, what kind of mental space does somebody need to be in, or not be in to consider aesthetic enhancement? What kind of relationship do you need to have with your body, your mind, your soul?
Yeah. That's a very, very good question, Ross, because I think when it comes to these kind of professions, it's about Dr. Tasneem, there's also that element of them also. I feel like they play a role in it, in being responsible as well as practitioners and people in the profession. What is your why? Because at personal training, I do the same thing.
Yeah.
Why are you trying to lose weight? I'm happy, yes, you're overweight, you want to come and do something about your weight. But can we really get to why you want to lose weight?
Are you trying to say something to you?
Did someone say something to you? Did your husband run away with some slim girl?
Yeah.
What is it?
Yeah.
Because the thing is, your why is so important. Why are you doing what you are doing?
Right.
You understand? And for me, as a mental health professional and somebody in that space, it's so important to understand the why yamoto, because you don't want somebody coming in because they don't have a good relationship with themselves. Yes, I'm overweight, I still love my body, but I am going to lose weight because it's hurting my knees, it's hurting my back, it's clogging my arteries, it's putting me at risk. That is a good reason.
Right.
You understand?
Yeah.
So, at the end of the day, you feel good and all of that, and we love it. But your why is so important.
Yeah.
And that's also why you need ethical and honest practitioners
100%.
who will actually steer you away from making decisions for the wrong reasons. People who are looking out for your best interests and who will do the right thing for you, whereas maybe you may not be in the mental space to make the right decision for yourself. You think, I need to have a whole lot of anti-wrinkle injections, but then your practitioner will say, hang on a second, you don't actually really need that. Maybe we need to do something else, or a little tweak somewhere else. But you actually don't think that you don't know what you need. The practitioner knows better.
100%.
And it has to be someone who you have full trust in to make the right decisions for you.
Yeah. And I think for me, one of the reasons what I love about Tasneem is, one, the way she's always really trying to better herself in terms of going for courses and things like that. And she's so honest. She, let me just give you a typical example. Remember the first time when we were in studio with her and you said to her,
I want some Botox.
I need some Botox. And she looked at you, she said, but Ross, you got such beautiful skin. We need people like that. We need women like that. We need people who are professional and who speak the truth and not just think about their pockets. At the end of the day, this is something that's been done on your face, Ross. It could be a good result. It could be a bad outcome. At the end of the day, we're not trying to hurt you as professionals. We're trying to give you what is good for you and what is good for your mind and something that you'll be happy with in the long run.
Right.
Yeah.
So, I like how we're having a conversation, about the mental wellness aspect of it, as well as, the medical aspect of it. This is where the line is. It's a very thin line and it's easy to kind of cross, it looks like, in my generation. So I'll share a little bit of perspective with you, ladies, about, my generation and where I see
the
things
Insta chicks.
The Instagram models and you know what I mean? I am part of a generation where, cosmetic procedure has been destigmatized.
Yes.
It's happening every single day. The ladies are open to it. That's why Ross is coming to Dr. Mitha saying,
everywhere.
I want Botox.
It's on social media. It's everywhere.
And Dr. Mitha's looking at me like,
hang on, girl.
Crazy. You know what I mean? So we actually don't see anything wrong with it because also the procedures have become less invasive, more accessible. There's doctors to administer these, enhancements. So, I think now where we look at the mental wellness aspect of it, what I see is that there is a lot of Western influence in what we're doing. As Africans or, on this side of the continent or the equator, there is just a kind of way women women are. There's a way their bodies are as well. That is not like on the other side of the equator. You know what I mean?
For sure.
But because, we have a lot of social and cultural influence from those sides, we tend to want to emulate and look like those people.
Yeah.
The lips are getting bigger and bigger and bigger. The bums are getting bigger and bigger and bigger.
We naturally have a good backside.
Tinier and tinier. And we naturally do have perky looking
It's more like the West is turning towards the African.
You know what I'm saying?
But I think they're even blowing it further out of proportion than, it was in the first place.
Yeah.
I was talking to Agatha earlier about what's known as a BBL, which originally was a Brazilian butt lift. If we take it back to the origin of the procedure or the bum itself, it's high, it's perky, it's not necessarily large, but it's round and it's firm, right? So now what is known as a BBL is this big, blown out of proportion, disproportionate thing where, somebody's bum is inflated.
It's ridiculous.
Ridiculously. It doesn't match their thighs. It just doesn't look natural, and
it's been made to look natural in the social media
100%.
circles. So you think it's natural, but it isn't.
100%. Yeah. So is there would the right phrase to label it be, is there sort of a body dysmorphia that happens where you do certain procedures, sometimes overdo certain procedures, and start to not really see yourself the way you actually look?
For sure.
Yeah.
Absolutely. There definitely is. What you said about young women is 100% true. I see a lot more young women coming in, young as in their 20s and 30s, wanting to invest in their aging because they are so in touch with what's happening out there and they know about things. Whereas I'd say about 5-6 years ago, I was still educating people about what was out there for them. Now they come in knowing already what it is that they want.
Listen, I want this and exactly it over here and over here.
So the young ones who are exposed to Instagram and TikTok and all of those other channels come in knowing what they want and they want to invest. What can I do to look after my skin so that I age better? Having said that, there are also an element of young women who come in wanting lips like so and so, wanting bums like so and so, and that's where, again, like I said, you have to have a practitioner who has ethics, who will be able to advise you appropriately. First and foremost, why? Why do you want that? Is it because you are trying to impress someone? Is it because you want to... And quite rightly, like you said, your nose and my nose are very different. Right? So you can't come in with a picture of someone's nose who has an Asian nose or Caucasian nose and expect me to transform an African nose into something like that. So, there are all those factors that have to be discussed. And I think that social media is damaging to a very large extent.
Absolutely.
And as practitioners, we have a responsibility to be able to educate our patients in what we can achieve with them realistically and what will suit them and what will not be dangerous for them as well.
And I think I face the same thing, especially it's just that I'm just a no-nonsense trainer and all my clients know this. When you start off with a client, somebody comes in with a picture.
I want to look like this.
I want to look like this. And I'm like, yo, fam. You're an ectomorph. It's going to take forever for you to get there. Or, you're not... Your genes are not of that person. You are a very unique individual, but we can make you look amazing for your body type.
Right.
You understand what and it's exactly what Taz is saying. I mean, you can't be African here and then thinking that you can get this other nose. You understand? We are who we are. And I think that is really one of the things that people really need to soul search on that. Like when you're coming in, there's nothing wrong with wanting to look a certain way, but look the best for you realistically. Capitalize on those big eyes that you have and make those big eyes look awesome. You understand?
And I'll be honest with you, this industry, when it comes to treating African populations, this industry is still very behind. And the reason I say that is because I do a lot of further training in Europe and in the USA. and 90% of the models that we treat are all Caucasians
Right.
of origin.
Right.
Yeah.
So Caucasians age very differently. Their features are very different.
And I think
their
quicker, no?
proportions are very different. Very much so
Yeah.
quicker. Yes,
Yeah.
absolutely. And I brought this up a few times as well, at the training institutes that I've been in, that, you guys need to be a little bit more diverse in the choice of models that you bring us, because I want to see African noses.
I'm from
That's who
Africa,
I'll be working on.
Exactly.
Yeah.
And Africans don't need cheek enhancement. They have beautiful, strong
Yeah.
cheek
Yeah.
profiles.
Yeah.
They need other areas, maybe under
Maybe
eyes.
jawline enhancement.
Or jawline enhancements,
Yeah.
exactly. Whereas a Caucasian, Asians, Indians, origins, they would need lips and cheeks, whereas Africans
Yeah.
don't need lips and cheeks.
Yeah.
So the industry is catching up, but not, it's getting there. And I
Yeah.
can see it, especially now that there's a lot more African injectors,
Yeah.
people, us like me, who work in this region, and who are now aware of those disparities. But I think the industry will catch up eventually, and it's important for the patient population to understand that that industry is still not fully geared towards treating the African population.
Right.
It's like somebody coming to me and like, kind of now I'm just like, okay, you already have, your backside is a certain size. And I'm like, just squat, babe, and just,
Yeah.
do this.
Every
and
day is
hey,
going
just
to be
squat.
like
You're
day
going to
now.
look awesome. You're going to have great thighs. You're going to have
Yeah.
a nice backside.
Yeah.
I mean, what's the problem? Why are you going under the knife? You know what I mean? You already have an amazing body. I can get it for somebody who wants to enlarge a little bit because they're not as gifted in the posterior as you are. You know what I mean? But I think sometimes as black women, I just think sometimes we're really ridiculous and we just don't appreciate what. Look at our skin, Ross. I'm 43 and my skin is still intact. It's just a matter of
genetic.
eating. Yeah, it's genes,
Yeah.
You eat right, you take care of yourself, you go easy on the booze, you'll be fine. You'll age nicely. And I think this is just an inferiority complex that black women have. They have just been taught to hate themselves, and not do aesthetics for the right reasons. You know what I mean?
Yeah.
And they really downplay their beauty, just the way they are. So this is why, Nagara, for me, the key person in all of this is an ethical professional.
Right.
That's it for me.
100%.
Yeah.
Yeah. Someone who will make you feel good about yourself.
Exactly.
And
Yeah.
want to help you to just bring it out.
Out, yeah.
Right. Specialist in advanced facial aesthetics. We're in conversation with Dr. Tasneem Mitha, as well as Agatha, Atlholang certified life coach, talking about aesthetic enhancement, as well as just that connection to your wellness and where you need to be in order to get procedures like this for the right reasons and receive them in the right way. Right. If you'd like to join our conversation, you are absolutely welcome to via WhatsApp +267 3956 962. We're also on that line over the phone. We're going to take a short musical break, play a very gangster song. The gangster music in studio tonight is for Dr. Mitha. Okay, it's not for us, it's for Dr. Mitha. This is KO featuring Madlera Doughboy on Let Me Cook. 8:12 is your time on Gabs of Empower to engage your world. These procedures, right?
Absolutely.
I want to talk a little bit. We spoke of Dr. Mitha about just the trends in what's hot right now in terms of these procedures, and what you happen to be seeing, especially where lips are concerned, faces are concerned, and other body structures are concerned as well.
Yeah, so it's interesting. We were talking about black women coming in wanting to have Western features because that's what they see on social media.
Right.
But it's also interesting that I see a reverse in that. In the industry. So, for example, if we talk about lips, a normal lip proportion for a white woman or an Asian woman would be a 1:3. Proportion of the top lip to the bottom lip.
Yeah.
Whereas an African woman has more of a 1-to-1 proportion. You've got
The bottom
an
lip
equal
is
size.
also thick
Yes,
as the top
it's-
lip.
exactly.
Yeah.
Your upper lip and lower lip are sort of a 1-to-1 proportion.
Yeah.
And it's interesting that seems to be the favored lip proportion nowadays in aesthetic that everybody would be coming for, would be more of a 1-to-1 pout as opposed to the 1-to-3 or 1-to-2 pout.
Right.
So, while, yes, African women do see a lot of what's happening on social media and do want to sort of emulate a lot of that, there's a lot of maybe some reverse procedures happening as well, where they want to have more African proportions of lips.
Yeah.
And the same would apply to BBLs, non-surgical BBLs.
Yeah.
As you know, BBL, Brazilian butt lift.
Right.
We do what we call a non-surgical BBL with biostimulators. And again, gone are the days of the long leggy models on the runway, skinny.
Yeah.
Women are now wanting more rounded, like you say, perky and bottoms, and that's also leaning more towards the African trend.
Right.
Small waist, big bum. So it's interesting that there are those disparities as well in the aesthetic field. So those are some of the trends that we're seeing as well. Another trend that we're seeing is that women are starting younger.
Yeah.
And like I said, they're coming in very interested to invest in their future.
I
and
like
in their
that phrase
aging.
that you used, to invest in aging.
Exactly, that's what it is.
Yeah.
And it's so nice to treat women younger. When I say younger, I mean sort of early to mid 30s, because they need less. They don't need
I
so
can
much.
Come into
Not yet. Not yet.
she said early to mid 30s.
They don't need a lot.
I'm 30 now.
Maitsu, not yet.
Let me tell you,
There's a line in my forehead because I furrow my brow a lot, and then when I relax my face, the line is still there.
As she makes her case.
I need the Botox.
well,
right?
this is it. It's so much easier to prevent than to turn back the clock.
Yeah.
And I love it when women come in their 30s and 40s, because then I have so much to work with. I have a free canvas to work with to prevent them getting to that stage.
Yeah.
But it's very difficult when someone comes in their late 40s, 50s, and even 60s, and then I have to work backwards.
Yeah.
And the expectations are so huge at that point. But the limitations of non-surgical treatments
Right.
are so limited,
Yeah.
and it's very difficult to explain that to people, because people expect a lot from non-surgical
because they don't want to
treatments.
go under the knife.
You have to have realistic expectations. So
Yeah.
that's also another trend. I feel that people are starting much, much younger.
Yeah.
And then I think, what I've seen over the last 5 years in terms of trends is that there's a lot of men in the aesthetic space.
Oh, wow.
Which is actually really, really interesting. They're
administering the
they
enhancements.
are very interested in what's happening, not only with skin treatments, but also with enhancements, with anti-wrinkle injectables, with fillers. We have procedures called masculinization, where you can take a male face and transform it into a more masculine male face by widening the chin, by changing the shape of the cheekbones, by defining the jawline. So, masculinization is becoming a little bit more predominant, I think, in the male arena. And so, I would say over the last 5 years, whereas previously I used to see only women, to be honest with you. But now there's quite a fair amount of men that are coming in for treatment. So those are some of the trends that I'm picking up over the last few years in the industry, especially here in Botswana.
Yeah. Agatha, as a life coach, I'm going to get to you about the relationship that you see with the, an older generations of women and aesthetics. But before we get there, Dr. Mitha, I want to talk to you, first of all, about just the history of enhancement, aesthetic enhancements, and let's look at the evolution of it as well, and where you see it going, the future of enhancements.
Okay, so this is so exciting, and I could talk about this the whole day. So, if we rewind 15 years in the aesthetic industry, it was a question of just filling in folds. So you'd come in and you say, I have a fold, or I have a crease on my face, or, I have a deep nasolabial fold, and simply we would just fill it in. Because you have a fold, we'll fill it in, right? And that resulted in a lot of very puffy, unnatural looking faces. The things that caused facial aesthetics to have its bad name. All those botched Hollywood faces and those kind of things we were seeing. Those treatments were done, I would say, 15 plus years ago, when we didn't understand about facial aging. Let's forward wind now, 15 years forward again to where we are now. We understand how the face ages. We understand how the skin ages. It's happening at the level of the bone. We're losing fat. We're understanding that the skin is aging in a certain way. So now we're treating much more appropriately to the
Right.
aging. We're replacing
Right.
volumes that are being lost. We're treating the skin issues. Whereas before, for example, if you have very poor skin quality, we would work on improving the skin quality first before we put in fillers in your face. Because if you put in fillers in a person with poor skin quality or even anti-wrinkle injectables, it will not hold the product as well as if you have someone with good skin quality.
Oh, wow.
Those are the kind of things people didn't know before, but we have so much more understanding about aging nowadays and also about the products that we use. We understand the products we use much better.
Yeah.
So we can manipulate different products in different areas to achieve different things. So that's the first thing. And the second thing is we know how long our products are going to last.
Yeah.
So previously, your doctor would tell you, come in every 6 months to do your touch-ups for your fillers. And we know now that's way too soon.
Really?
Again, you go in every 6 months, you were doing fillers every 6 months or whatever the case is, that is, you were having too much product in your face and that caused you to look unnatural, caused migration of your products, caused shifting of the filler, into areas you didn't want it to go. So now we realize the longevity of the products that we have in our hands. And now we're so much more conservative, coming after 18 months, coming after 24 months to do the tweaks. So we're not overfilling your faces because we understand the products and how they work. So in terms of evolution, I feel we're much more informed as doctors to be able to give our patients more natural, more longer lasting results because we know what to expect now with our products, and we know what areas of the face we're targeting, whether we're targeting bone loss, volume loss, skin issues, or whatever the case is. So that's one of the main things I think is how this profession has evolved. And as to where we're seeing ourselves, it's actually such an exciting time to be a practitioner in this field at this particular time. It's actually such an exciting time to be a woman in your 30s and 40s during this time, because there is so much out there. And what's really, really very big and very current at the moment is regenerative medicine. So now we're not just filling and replacing volume loss. Now we're actually working on a cellular level to help you to age better. We're understanding what's happening on a cellular level in terms of the skin and the collagen and the elastin, and what happens when you reach perimenopause, what happens when you reach menopause. And now we're using things like biostimulators, polynucleotides, exosomes, all these really nice, interesting products that are coming out in the last 2 years. I'd say it's probably about 1 to 2 years old, which are now stimulating your own skin to age slower.
Wow.
So we are now in control of how fast you're aging.
I love that.
And how well you're aging. And this is all new and it's exciting. And I think, as women, we're so empowered now with all the choices that we have available to us. There's no excuse to age badly anymore. So I feel regenerative medicine is now taking over from the basic, toxin and filler and whatever the case is. And now women are now looking to not only look better but to age better as well.
Right.
So that's where it's going.
I appreciate that insight and that
Watch the spot.
perspective. Yeah. So for somebody listening to this right now who has always kind of played into the stigma of aesthetics and enhancements, now learning that it's so advanced now in terms of just what it's doing for you rather than taking from you in the long run, then it's comforting, right?
Yeah, and not only that, I mean, like for me, I'll say it again, you need to go to somebody who knows what they're doing. You need to really be careful who your doctor is. It needs to be somebody who's informed, who understands what's going on in the industry, and not somebody who's just going to say yes to everything that you want. This is such a sensitive thing. It's such a sensitive topic, and women really need to make better choices in their selection of who it is they're going to trust their bodies with.
I think on that note, if I could just add something, I think it's important to do your research as a consumer with everything in the space, but especially with your aesthetic injector. You need to do your research. You need to find someone who has years of experience behind them. You need to find someone who has a reputable profession.
Absolutely.
Word of mouth is amazing because, you can't always believe everything you read on social media. People will always put their best work forward.
Absolutely.
On social media. But word of mouth I've been to so-and-so dentist, I trust her, or whatever the case is also very important. So you do your research. Avoid Dr. Google. I hate Dr. Google because it gives a lot of misinformation.
Absolutely.
I think you need to discuss things with a practitioner who will give you the honest and right answers of what is good for you and not good for you. Google doesn't know your face.
Absolutely.
They don't know what ethnic race you come from, what age you are.
Yeah.
It's not going to give you the right advice for you. You need someone who you can trust to give you the right advice for yourself. And most importantly, you need to avoid cheap scam fakes products. There's a lot of people out there who are not medically qualified to be providing these kind of treatments. And I will say it again, as safe as aesthetic treatments are, and they're non-surgical, so we assume they are safe. There are risks involved. And we go through years and years of training, and Agatha will tell you, I invest a lot of money in traveling overseas and learning from people,
and
learning from injectors from all over the world for a reason. Because there are risks associated with this procedure, and people who do not have the qualifications can severely injure you or mess things up for you, and it can be very dangerous in the wrong hands. So you need to go to someone who is very well versed how to treat any complications that come their way or your way, and how to confidently reverse complications, how to treat a variety, whatever the case is, how to treat skin of color. Skin of color is a very, very difficult thing to treat, and if you go to someone who's not experienced and who doesn't know that, they can mess up your skin. They can cause you to become hyperpigmented, or even underpigmented, hypopigmented, so it's important to go to someone who is qualified and who knows how to deal with complications. There's a lot of salons out there who offer this and that and whatever the case is, and I would really, really think twice about going that route. It might be cheaper, but I always say cheap doesn't mean good. And I always say if you pay peanuts, you get monkeys.
Right. You really get what you pay
monkeys.
for.
So you need to, if someone is expensive, you need to know they know what they're doing. Let me put it that way.
100%.
Because they have confidence to charge what they're charging.
I agree.
Because they know what they're doing.
I agree. And Ross, like Facebook, we see horrific stories of BBLs gone wrong. I personally know of somebody who went off, got a BBL, and she's in the hospital right now, and she's really struggling, and it's just a mess,
Shame.
So people really have to be careful about who they're choosing and who they're allowing to put their hands on them.
And what's being injected into them. That's another thing, Nowadays you can buy stuff off Amazon. Who's there to see, has this been FDA approved? Has it been CE approved? Is it safe to be injected into your body?
Let's not be ignorant,
exactly.
guys.
So because so-and-so is selling it cheaper down the road doesn't mean
that it's the best thing.
They could have got it off, take a lot or whatever the case is.
That's crazy. One day maybe we'll do an episode about shopping for aesthetics, shopping for the right doctor, shopping for a surgeon, all of that stuff, what to look for, what the questions to ask are as well. Because a lot of people are very shy. They'll just kind of, okay, Dr. Mitha's on Facebook. Let me just go there. I guess, because she's on Facebook, she's legit. I'm not going to ask her if she's qualified enough to do this. So, we need to have a conversation about how then to confidently, because it's your face at the end of the day. This is you and your body that is on the line. All right, we're gonna come back. I want to talk to you, Agatha, again about, as a life coach, just what you are seeing in a certain generation of women. What is going on in their heads? All right, just after this short break. Attention, all beer and cider lovers, get ready for a lager toast. Dr. Tasneem Mitha. I'm getting a little too excited about Botox over here, which Dr. Tasneem is gonna give me for that line right there in my forehead that Agatha pretends she doesn't see, but
that Agatha pretends she hasn't had either.
Anyway, I'll be calling you Dr. Mitha. We're talking about, facial enhancements and aesthetic enhancements and just your overall well-being and wellness as a woman. Agatha, as a life coach, what are you seeing, Hella, in your camp as well as in your generation of women and older about just the attitude towards this, the mindset towards this as well?
Way back in the day, Ross, you would see, even in the magazines, honestly, you'd see this older woman with gray hair, beautiful skin, wearing this linen dress, and you can see, this lady is a woman in her 60s and she looks amazing and she's aging gracefully, Today, it's like women are so afraid to get older. And there's really, there's this talk about ageism, women are not being considered. It's like the world shuns women when they get to a certain age. Madonna. I think it's sad. I look at someone like Madonna. Madonna is somebody I used to listen to. When I look at Madonna now, she's just a sad state. It's a sad state of affairs.
She was a role model for all young women.
And I look at her today and I think to myself, all those years of all of that hard work, everything that you've put into it. Yeah, look at what it is now. She's just out here thinking she's like 16 years old or something. It's really sad.
Yeah.
And this fear of getting older. What is the
Why
scientific...
do you think women are scared of getting older?
It's because we're not in touch with ourselves and we don't understand the different stages of life, I think.
There's a word for it. Agatha, you mentioned it earlier.
Gerascophobia or something. Gerascophobia. Yeah. Exactly. Let me just read on this. Some people fear aging so much that it becomes a pathological condition, which leads, and this form of pathology leads to irrational thoughts and behavior. For example, a fixation on health, illness, and mortality, and a preoccupation with hiding the signs of aging. You understand? So we've got this problem. The older we get, it's like we feel like we are disposable. Women feel like they no longer have it. Society no longer wants them. We are used goods and stuff like that. That's how women view themselves. And the funny thing is, there's so much wisdom with age.
Yeah. Sure, and beauty and grace and elegance.
Because Tez, when I look at a 60-year-old woman who's got gray hair and her hair is an afro, she's got beautiful skin, it says to me, someday you're going to be this old, and this is how you need to take care of yourself.
I think there's nothing that's more attractive than an older woman who's confident in herself.
Taz, I kid you not. And for me, because I'm a Motswana living in Botswana, black women are so afraid of getting older. They're in competition with young girls. And I'm sitting here and I'm thinking to myself, ladies, all we need to do is start taking better care of ourselves as women in our youth. Yeah. Let us not waste our youth.
Yeah.
Take care of yourself. I started training when I was 21, Ross. I started hitting the gym when I was 21 years old. I'm seeing the return on investment in my 40s.
Right.
I'm still going to look amazing in my 50s. I know this.
Yeah.
I'm still going to look amazing in my 60s. Granted, I don't have children. Look at Tasneem. Tasneem looks amazing with 4 kids. I train women who look amazing with children, who've got their own companies, who are working. It's all a matter of investing in yourself.
Yeah.
And not trying to look like you're 21-year-old. Because your 21-year-old does not have the life experiences that you have, my darling. And at the end of the day, you're always, always, always going to have more insight, which you need to share with your daughter or the young ones. And who are young people going to come to when they've got issues and we've passed through these issues and we know how to resolve them if we're not acting our age. I'm always like, yeah, babes, don't look your age. Yes, it's fine, but act your age.
Yeah, for sure.
You have to act your age.
I think young women today want role models.
They do.
And I think it's important to be a responsible role model out there. And just to touch on that, Aggie, I'd like to say that from the facial aesthetics perspective, there's a lot of misconception out there that facial aesthetics, non-surgical facial aesthetics particularly, is there to make you look younger. No, that's not what it is. It's there to make you look better for your age, whatever age you are.
I like that.
So in your 50s, we'll make you look an amazing 50 with glowing skin and beautiful features, and we'll enhance what you have. Whereas we're not trying to make a 50-year-old woman look 30. That's not the objective of non-surgical facial aesthetics. When you're in your younger years, like in your 20s and 30s, we're there to help you prevent getting worse with age and improve your skin quality and improve your facial features. So that's also an important thing. There's no vanity associated with this. This is just there to empower you to look and feel the best wherever you are in your life, so that you can face life with confidence.
It's absolutely the same with gym, and I love what you said. You know, a 21-year-old client has a very different body to a 40-year-old woman who's got 3 children, you know, and you've got to be realistic about where you are, you know. And I really love what Taz is saying. We're going to make you look awesome at 50. We're not trying to make you look 60. You know. So I think we really need to look into that. Also, one thing that I want to add, women, in as much as, yes, we are hypergamous and we all want the best man out there, you're not trying to look for a man who's trying to change you, fam. You know, who wants you to look like a stick. We want a man who says to you, babe, go to the gym, take care of yourself. Not a man who says, I want you to look like Hailey Berry. You know, and that's another thing, Kabasadi. We're always trying to impress men. Men. It's great. Look amazing for your man and everything. But at the end of the day, it should be healthy. You know? So let's also be careful about that.
And you need to think about your why.
Your why.
Yeah. All right, ladies. Thank you. Let's wrap up the show now for real. Okay. Thank you so much for joining me, ladies. I'm always, I take for granted actually how good it is to have you two in studio to have this conversation, not only with me, but with, all the women listening to the Wellness Pod right now. It is a necessary conversation, and I'm very grateful to the both of you for joining me in studio today.
Thank you so much for having us.
All right. Specialist in advanced facial aesthetics, Dr. Tasneem Mitha of Dental and Facial Aesthetics. Where can we find you, reach you, if we're looking to consult and have a genuine and open conversation about, getting some work done?
So my clinic is based in Karong Clinics, which is near the main mall. And you can have a look at our website to have a look at the services that we offer. The website is www.dfa.co.bw. You can find our contact details on the website. We're also on Facebook and Instagram as Dental and Facial Aesthetics BW.
Love it. And Agatha, if we need life coaching, because we need life coaching, where can we find you?
75749948. That's 75749948. Drop us an email, info@genuinefitnessbw.com. We're on Facebook, Ikage Motswana. We are on YouTube, Ikage Motswana The Pod. Watch all the episodes, guys. If you miss them on air, we're loading them every single month, so you can catch up on that. And really, ladies, no pressure. Your own race, your own pace, your own time.
Right.
Don't overstress yourself. Live your best life, but be healthy, mind, body, and soul.
I love it. Sure. There's not much more to say after that. Ladies, thank you. I love you and I appreciate you. Good night.
Thanks,
good night.
Alrighty. 8:45 is your time on Gabs FM, Power to Engage Your World. Don't say that. Powering on with the rest of Purple Nights while I still have the show. All the way till 10 p.m. My name is Ross and I'm your host for the evening. A message from the Pussycat Doll saying, don't you wish your girlfriend was hot like me? Oh.
boy.